Good morning. Good morning and welcome to the Boston Foundation. I'm Paul Grogan, the president of the foundation, and we're very pleased to host this important conversation this morning on active minds and active bodies. I think many of you are familiar with the Boston Foundation, but for those who may not be, we are Greater Boston's community foundation, a 100-year-old charity that has in its life provided over $1.5 billion to Boston area nonprofits working in a wide variety of fields. Last year we distributed $112 million in grants, but we also serve as a civic leader and convener, as we were doing this morning, and Understanding Boston, the program that this is part of, is one of our core programs, a series of forums, educational events, and research sponsored by the foundation to provide insight into issues affecting Greater Boston, its neighborhoods, and the entire region. Programs like this are supported by donations to our annual fund, the Civic Leadership Fund, and donations to the permanent fund, that is the unrestricted endowment of the foundation. We're deeply grateful for those of you who are supporting those funds. Today's forum and the report we are releasing really joins two major priorities of this foundation, health and education, and supports our work to reduce disparities in health outcomes, especially in terms of obesity and obesity-related preventable chronic diseases across neighborhoods, races, ethnicities, and all income levels. By way of background, in 2007, the foundation partnered with the New England Healthcare Institute, or NEHI, to publish a report called The Boston Paradox: Lots of Healthcare, Not Enough Health. This report drew our attention to the growing crisis of preventable chronic diseases that not only threatens the physical health of Greater Boston's residents, but causes an increase in health care costs that serves to crowd out investments in other societal priorities. 2 years after that, we followed that report up with a second report called Healthy People in a Healthy Economy, which warned that rising levels of preventable chronic disease pose a challenge to our economic competitiveness as well as a public health challenge. And like lots of parts of the country, we have an obesity epidemic going on in Massachusetts. The childhood obesity rate has now is 30% of our children are either overweight or obese, and it's a risk factor, as we know, for numerous preventable chronic diseases, from type 2 diabetes to heart disease, and obesity-related expenditures are estimated to cost Massachusetts more than $1.8 billion a year, a cost that will continue to rise unless we take action. In response to this, the foundation launched something called the Healthy People, Healthy Economy Initiative, which is a broad coalition of business leaders, healthcare providers, public health advocates, political and civic leaders, to advocate for important policy changes to make Massachusetts the national leader in health and wellness. At the same time, in our education work, we have invested in creating the conditions for all schools to succeed, including expanding school autonomies with additional learning time, hiring and curriculum autonomy, and supporting new models of governance that focus on meeting the needs of all students. And in promoting these policies that advance school autonomies, we also recognize that some of the changes made in school curriculum over the past decades have had unintended negative consequences. Budget strains and curriculum changes, coupled with the shortest school days and years in the country, have seen Massachusetts schools reduce their offerings in the arts and physical education, sometimes drastically. While Massachusetts law states that physical education shall be taught in schools, state education regulations no longer prescribe the amount of time students must spend in physical education classes. So by 2009, almost half of all Massachusetts public school students did not participate in physical education classes, and today 30% of Boston's public schools offer no physical education at all. This is counter to the current evidence-based guidelines that recommend at least 60 minutes of physical activity per day for youth, with at least 30 minutes occurring during the school day. Restoring physical activity to their school day is an important step in reducing childhood obesity and improving the overall health of our school-age children. This morning, we will hear about an exciting research project that was conducted by Dr. Jennifer Sachek and a team from the Tufts Friedman School in the Lawrence schools to evaluate the impact of a school's physical activity environment on how children meet how it affects learning. It is fitting that the research was done in Lawrence. Lawrence is typical of the so-called gateway cities, mid-sized urban centers that anchor regional economies around the state. Yet over the past decades, as manufacturing jobs disappeared, has suffered from serious fiscal and operational challenges at the city level. The city has also seen demographic shifts and is now home to vibrant Dominican and Puerto Rican communities. In 2011, the Lawrence Public Schools were designated as a Level 5 district, and Jeff Riley was appointed as receiver superintendent. Building on the contributions of many stakeholders, Jeff developed a district turnaround plan that was approved by Commissioner Mitchell Chester in May of 2012. Since that time, Jeff and his team have been working diligently on a number of priorities to improve the Lawrence schools, from extended learning time to important changes in union work rules to a full review of the district's resources. And this work appears to be paying off. Students in Lawrence Public Schools made strong gains in performance last year, particularly in mathematics. The percent of Lawrence students district-wide scoring proficient or higher in math increased between 2012 and 13 by double digits in grades 3, 5, 8, and 10. The population of the Lawrence schools and the autonomies granted to the schools make it an excellent setting for the research that's being presented this morning. The Foundation was pleased to support this effort, and I would also like to take a moment to thank the New Balance Foundation, our funding partners in this effort. We couldn't have done it without their participation. What we're going to do in terms of the program from here is, we're going to, first order of business, of course, is to hear a presentation on the research itself by Dr. Sachek. We're going to have brief remarks from Seth Racine, the Deputy Superintendent of Schools in Lawrence, and then an excellent panel moderated by our Director of Healthcare Programs, Allison Bauer. There will be time for a Q&A, opportunities for you to quiz our panelists or experts, and we will wrap up at the latest at 10:30, as we customarily do. Now it is my great pleasure to introduce Dr. Sachek. She is an associate professor of nutrition at the Friedman School of Nutrition, Science, and Policy, and an affiliated faculty member of the Tisch College of Citizenship and Public Service at Tufts University. She holds a master's degree in exercise science and a PhD in nutrition science from Tufts, and completed a postdoctoral fellowship at the Harvard Medical School in muscle physiology. She's a fellow of the American College of Sports Medicine and an active member of the Obesity Society. Dr. Sachek's research focuses on the impact of both diet and physical activity on health across the lifespan. She's written several pivotal reports on obesity and physical inactivity in New England, and was an appointed member of the Institute of Medicine's Committee on Fitness and Health Outcomes in Youth. She's a competitive master-level rower and an avid runner, and frequently speaks to athletes of all ages on optimizing nutrition for performance. Please welcome Dr. Jennifer Sachek.
Hi, thanks for being here this morning, and thank you to the Boston Foundation for having me speak about this important work that I am quite passionate about. And obviously I'm from the Friedman School of Nutrition, but this is one of my favorite topics, physical activity. So talking to you today about the report that will be available to you after this today, Active Bodies and Active Minds. So I know Paul alluded to the current recommendations in terms of what children need to be engaging in with moderate to vigorous physical activity. Back in 2008, researchers came together and said, look, 60 minutes of moderate to vigorous physical activity daily is what our children need in this country to be healthy. And following up on that, around the same time, I know that a lot of us are very aware of self-reported physical activity measures and saying, oh yes, I was this active over the course of the past week. But this was the first time national representative data on objectively measured physical activity was actually published, and showing here, which quite strikingly, I think really got a lot of people's attention. Looking at the 6 to 11-year-olds, the demographic, the age group that we're going to talk about today, about 50% of boys are meeting the recommendation, and only about a third of girls are meeting the recommendation. And then this is followed by a precipitous decline come the middle school and high school years. And I want people to sort of remember this, because this will come into context later in today's talk. And about, with, sort of this knowledge, physical activity has seen a resurgence in terms of its importance in health for children. And just about a year and a half ago, there was an Institute of Medicine report that released Engaging the Student Body that really realized that, look, children are spending the majority of their time within the school setting. So schools clearly are a critical place for children to engage in physical activity. And at this time, they really recommended, again, as Paul mentioned, 30 minutes should be engaged in during the school day. So 30 minutes of moderate to vigorous physical activity is what is warranted. But we can't just put this obviously all on PE or recess, which we know there are huge constraints on in this day and age with budget cuts, but really calling for a whole school approach. So calling on not just the physical education teachers or the principals, but teachers, administrators across the board to help children be physically active. And again, this will come into play later when we talk about physical activity environments. So why do we care about this today? So I think having been a researcher in schools trying to promote, how important physical activity and nutrition are for health and, preventing cardiovascular disease, obesity, et cetera, school administrators often are in the here and now, and they're like, well, really what's important to us is obviously, standardized test scores. We have to perform well in order to, make the cut. And we were blessed with some data from one of my colleagues, Ginny Chomitz, with some 2005 data in Cambridge, not looking at physical activity per se, but fitness testing. And this data shows a clear link with the number of fitness tests passed and the odds of doing better on both math and English learning arts standardized test scores on the MCAS. So with each, incremental increase in number of past tests, fitness test pass, they performed better. This was a nice first snapshot of what is going on in terms of being physically active and fit and academic success. And I want to point out academic success, in my mind, is a health outcome. So more recently, one of my friends, collaborators to a certain extent, Chuck Hillman published a great study this past summer in pediatrics. He was the first to actually get young children randomized, so this is a large trial, to an after-school program that encouraged physical activity for about 2 hours per day versus children who are on a waitlist control. And he really wanted to see what kids' brains on exercise did over a 9-month intervention. And the results were striking. I think a lot of people here are familiar with executive function. So these were executive functioning tests. And you can see on the left, the kids' brains who were in the intervention schools with physical activity lit up when they performed these executive functioning tests. So they not only did better, but their brains went off like firecrackers when they were doing the tests. So clearly, pointing to the health benefits of becoming more physically fit and active and making a huge change, not only in how they perform, but the physiology of the brain. So that brings us today in the report, and I think that it has been, we have paid attention to sort of the interest in changing policy, mandating physical activity within schools, but still in Massachusetts we're lagging behind in terms of really, being thoughtful about how much PE we need, how much recess time, how much time are we allocating towards physical activity. And I think it's really important for, policymakers, researchers, and those invested in physical activity to know what the data are. And I think Paul made the nice, introduction as to why Lawrence and why Lawrence was a great place to look at this initial snapshot of what's going on with physical activity. Again, it's a low-income community. 85% of the children live in low-income households. 90% are Hispanic. 45% are overweight or obese. Amongst sixth graders this past year on the 2014 MCAS, 61%, about 60% fall into the failing or needs improvement on the standardized test scores. So clearly they've made great strides over the past 3 years in the turnaround effort. They've also tried innovative strategies to make these standardized test scores better, but they're also a prime place where we can look at the relationships to physical activity and health. So I think really it's a great place to look at what's going on now and see how those changes can take effect over time. So the research goals, as the researcher that I am, going into this were several-fold, and clearly there's a lot of ways we could look at this data. But first and foremost, I think objectively looking at physical activity, how much physical activity are children engaging in and when? I think we had from that national data set a sense of, in general, what children were engaging in, but that was a sample of the United States population. We need to focus on what's going on locally and when they're engaging. And school time and total daily are important key measures to look at in terms of where should we focus our attentions. Second is to look at the physical activity environments within individual schools. How supportive are they of physical activity programming and policies? How does this impact physical activity levels in these children? And also, in turn, how does this impact academic achievement in these kids? So the population, we were fortunate enough to work with 450 third through sixth graders in 8 public Lawrence elementary schools, so they're middle and elementary schools. Data collection, we went out with a team of researchers from Tufts, great graduate students for sure, and did measured height and weight. We had questionnaires, parents filled out demographic questionnaires, we had some questions on behavior, all the things that we needed to sort of control for the right confounding variables in our analyses. And also, we partnered with the Massachusetts Department of Elementary and Secondary Education, and this is key, to get individualized MCAS standardized test scores, not just to see what the school was doing, but that we can link to individual child to their individual MCAS scores, to their individual physical activity levels. So that was really an important thing. So we're not talking about the school level. All the data I present today are really from individual children that participated in this study. So the physical activity assessment, I think I alluded to the fact that, you can ask a child what they did last week and you might get something that is not really representative of what they might have done. So we decided to embark on measuring children with an objective measure of physical activity. This involved outfitting the children with an accelerometer. Many of you might be familiar with that. Around their waist, they wore it for the entire day. The only time they took this off was while they're sleeping, bathing, or swimming. And this gives us an objective measure of how much moderate to vigorous activity these kids are engaging in. And we only used valid accelerometry data, so the kids had to wear it for at least 3 full days for greater than or equal to 10 hours a day. So this is pretty strict criteria if you're familiar with the literature at all. And these kids in Lawrence were rock stars. I think we lost 2 accelerometers out of 451 kids. So they are very responsible if, I have to say, they're awesome. So they were in a gift card at the end of the week helped too, to bring it back. But so we're the state of activity then. I think I want to say that what I'm presenting today is Lawrence data, but having done also some pilot work across the state, these data are also very similar to what we're seeing across the state. So this is about Lawrence in particular, specifically, but we, don't say that they are any different from across the state because this is what we're seeing statewide. So I think that's an important piece of information. So the percentage of children meeting those recommendations that I talked about, the 60 minutes of total daily moderate to vigorous physical activity, only 16% of children were meeting that recommendation. Very disheartening. 10% meet the school time recommendation. And for most of my presentation of the data today, I want to focus on school time because we're, I think, focusing on schools. So 10% meet that recommendation. So really, this is less than even meeting the total daily. So really showing the critical need. But again, there are significant gender and weight status disparities that I want to highlight. And this is probably, beyond the general lack of physical activity, which obviously is a huge concern, there are data that I want to highlight in a little bit more depth. So this is a slide showing gender disparities in meeting the school and daily physical activity recommendations. In blue is the total daily, the 60-minute recommendation. The green is meeting the 30 minutes during the school day recommendation. And you can see that, the boys, about a third of the boys are meeting the total daily. Girls, about 18%. You get into, so about 10%. And then boys for the school time, 18%, and girls about 6%. So what we are seeing here is about a third. The girls are engaging in about a third of, are successfully meeting their recommendation, only a third of what the boys are. So it's not that the girls are a little bit less, about half. It is much less than that. Now, also looking by weight status disparities. I know we've talked about obesity prevention. It's critical for health and health outcomes. I think a lot of us as researchers sometimes lump the overweight and obese kids into one category. Here we separated out the data between normal weight children, overweight, which we know there's a lot of overweight children in Lawrence, and obese children. And the interesting thing here, and I was very happy to see this, is the normal weight and overweight kids, even though they're not meeting the recommendations, they're very similar. So at least there's not a disparity there. But it's those obese kids, again, that they're really falling off. So our attention really needs to be on the girls and these obese children. So I think that's where those points are important things to drive home. And going back to the gender disparities for the girls and boys, I think it's also important to see what is happening in school, out of school, and total daily, and the minutes that girls are engaging in versus the boys. The first thing you'll see here is across the board, girls are lower than the boys. No surprise based on what we've seen so far. And your school day recommendation in the red dotted line here is 30 minutes, and the total daily here in 60. But what I want to point out here is, remember, we want kids to engage in half of their physical activity during the school day. These kids are actually engaging in more activity during out-of-school hours than in school. And I think we could have an interesting discussion later that maybe in Lawrence, a lot of these kids do go to after-school programming, like the local Boys and Girls Club, a YMCA, which is phenomenal, things that we still need to look into further, but still there's room for improvement within the school day. So who, though, is there any glimmer of hope? You know, what's going on and where, and who is moving more, and why is this? Planting a couple of seeds here with these next two slides. I want to talk a little bit about Spark Academy. Many of you might know about the Spark Academy. It is I'd say an innovative endeavor in one middle school in Lawrence, who is basically enabling kids to have the opportunity to engage in 2 more hours of physical activity per school day. And this is in the form of added PE or a fitness class time. And these children are also, and this is important to keep in mind when you think about gender disparities, the kids are all wearing clothing that's very conducive to being physically active. So the girls aren't wearing stilettos and not able to engage in physical activity. They all should be able to sweat a little bit and engage. But again, I think, and we compare the kids, you know, how much are they engaging in Spark versus those kids who are not in a school who's really pushing the physical activity. And you can see here's the red line again about where they should be at. In blue, you have boys and girls and a non-Spark school. And then the Spark is in green. And you can see the boys are handily exceeding the daily recommendation of 30 minutes, which is great. We're like, thank goodness, it's working. We can get them engaged. It's phenomenal. And then you look over at those girls, and you're like, geez, you know, they're doing better than those other 5th and 6th graders in other schools, but they're not close. What is going on here? And I'd love to plant that seed for further discussion. But still, here's an example of a school that's sort of incorporated a whole school approach to get kids on a mission to be more active, and they are making the move, and I think that's a positive. But there's still probably things that we can learn from this. All right, here's another interesting one. On the parent permission form, we happened to ask about children's behavior problems, communication problems, attention problems, and if they were on an IEP or not. And we thought, hey, we would use this data just to sort of, because we're collecting standardized test scores, to sort of, you know, control for that if there's any issues. But when we looked back at the data, we're like, wow, there's this interesting thing going on. If a parent reports a child having a lot of behavior difficulty, their physical activity levels are really high. And again, looking at the school, you know, and the daily physical activity levels, they're almost meeting those recommendations. Where if a child is, you know, perfectly well behaved and attentive or not on an IEP, they're really not engaging a lot. So this is a snapshot in time. This isn't saying a child misbehaves, you know, because they're running around like crazy, not paying attention. What I think is these kids actually need to be really physically active, and maybe those teachers are allowing for extra physical activity opportunities because they know that, and maybe this draws attention to, hey, don't you think maybe those other kids probably need to be physically active too? So there's a nice direct linear relationship here that clearly needs to be investigated further. Okay. So that's a snapshot of where we're at in terms of the activity levels. How about the environments? How physical activity promoting policies and programmings are actually impacting physical activity and academic achievement? And how we use this is we basically went into schools and talked to a principal or someone who knew a lot about physical activity in the school and asked about 5 key areas. When we're talking about the whole school approach, again, physical education and recess are typically cornerstones, but also classroom physical activity, before and after school programming, and other physical activity initiatives. And we did an environmental scan, so we could sort of rate on a, you know, a scale of where they were in terms of really positively promoting versus low physical activity promotion. So what we found in these schools, these 8 schools that we looked at, really there were some strong links between 2 things that we think would be the case. If a school was highly promotive of physical education, and here this criteria is pretty tough, is schools require at least 150 minutes of PE per week. Those children engaged in about 22 minutes during school versus schools that did not were around 15 minutes. Similarly, recess. If they offered at least 100 minutes of recess and had structured, basically organized recess that allow for a supervisor, structured activity, again, these children are closer to 18 minutes of moderate to vigorous physical activity versus about 13 minutes. So these were two key findings. Again, these are controlled for all the things that need to be controlled for in analyses. But the interesting thing is there's no school in Lawrence per se that basically did perfectly in all domains. And the areas of greatest need still seem to be, and for opportunities, are classroom physical activity breaks and other before and after school programming, like having both available to these children. And how do these environments then shape their minds? I think what we are all very curious about. Does the physical activity environment then basically link to standardized test scores, cognitive health, and attendance? So this is a slide showing, and this is just from the children who participate in this study, looking at a percent of students with MCAS scores proficient or advanced, because that's basically what we want the kids to be at. That's the bar. If you look at the math, 2013 to 2014 data, and in green are the schools with a highly physical activity promoting environment. They are higher than those with a low supportive environment. Again, in 2014, in English learning arts, across the board, if they had a highly physically activity promoting environment, they scored higher on these test scores. Now, this isn't necessarily saying, hey, the physical activity environment is causing those higher test scores, but what I would suggest is there could be something there. And these could be schools that are really investing in health, other resources, and attention to other things that might help them improve their success on these test scores. But in a separate equation or model that we looked at that I think is quite compelling, when you control for all the covariates like weight status, parent demographics, age of the child, we find that children actually in schools with a highly promoting physical activity environment are 2.5 times more likely to achieve advanced or proficient on math MCAS. And I think literature before has sort of alluded there's a stronger relationship with math test scores than with English. And here again, we're seeing, look, if the environment is positive, they are 2.5 times more likely to be advanced or proficient on those test scores. And this is the last sort of data slide, and what I want to present here is something that we hypothetically want to talk about. Let's say you're a school administrator, a principal, and you said, look, I'm a highly, promoting physical activity. I have a highly promoting physical activity environment in my school, and what could I predict then, especially if I'm going to put more into promoting physical activity policies, down the road, if I'm going to do these things, what is the likelihood that my children in blue here would achieve a proficient or advanced? If you look at the high physical activity environment, you would guess then, you'd predict that 70% of your kids would achieve the proficient or advanced. Whereas if you had a low physical activity environment, it'd be a lot different. So basically there's an inverse relationship. You would have 70% that are going to achieve high and only 32% low. Conversely, if you were a school that's like, look, I'm not going to invest in this, I can't, we're just going to drill down the math and English and we're not going to do any physical activity or health, maybe those data are lower. The predicted values are only 60%, 57% of kids would be proficient or advanced, whereas 43%, a much higher number, would be the lower scoring. So I think these models as to what could come, this is a snapshot of possibility, is very important. Also, there's key pieces that we found that if schools did little things to show their extra efforts, like promoting fitness or classroom activity breaks, they were more likely to perform better on math, standardized test scores, and English. So here's these key factors in terms of investing time into multiple things to actually change how they do academically. So the study implications then, I know it's a snapshot of a lot of data, but I want to drill home that more physical activity is needed for all children. So this isn't just Lawrence kids, this is across the state, and I think that, further research that we hope to publish will demonstrate that Lawrence isn't different in that way. But there are, significant gender disparities, and I think that also is existing across our state. Something that didn't go away in the 70s with Title IX and needs to be at the forefront of our attention. Obesity is a problem, and there's a disparity there, but it's a much smaller percentage of our population. Half the population is female, so we have a problem there. And there's really a need for the whole school approach. I think that doing a great job with PE and recess is phenomenal, but it still might not be enough to throw those children over the bar of meeting the 30-minute recommendation or getting to the total daily of 60. Unfortunately, I think we have to do a lot more throughout the school day, really getting people on board and sort of fighting for movement while learning is key. There's no one magic bullet. And these environments then, I think there is a strong linkage to academic success. I am very hopeful that future studies will nail this down further, especially at a local level that can hopefully drive policy. And I just want people to remember that this is a snapshot in time. We're using individual level data, but we're not going in, putting in an intervention, looking at baseline and looking at this over several years. Longitudinal studies need to be done to definitively show these relationships and tease out factors that might come into play. So with that, I want to thank all of you who are here today for your support of children's health and movement. I think it's critical. Obviously, nutrition is important too. My co-investigative team, I couldn't have done it without my awesome project manager, Catherine Wright, and my really smart co-investigators and great doctoral student support. The Lawrence Public Schools Superintendent Riley for letting us come in and work with his children, the 8 principals that let us into their schools, and the parents who consented to allow their children to participate, and obviously the kids who probably drove their parents to sign the form because they really enjoy participating in the study. And then thank you, obviously, to the Boston Foundation, Allison Bauer, and the whole team at New Balance for funding this research. Thank you.
Dr. Sachek, it was very appropriate to thank the Lawrence Public Schools and Superintendent Riley. Superintendent Riley had hoped to be with us this morning, but my understanding, Seth, is doing something with the Boston Celtics, so it's at least in a connected realm, and we're very pleased to have his top deputy, Seth Racine, from the Lawrence Public Schools, who we will hear from in just a moment. But I too want to thank you, Seth, and the superintendent. There's a lot going on in Lawrence, as we know, simultaneously, and they made room for this amidst a lot of other initiatives and experiments, and it required a considerable commitment from them. So we really are grateful that we were able to do this. And Lawrence, as Dr. Sachek said, was really an ideal environment for a lot of reasons to conduct this. And it is a district that has already made a very considerable commitment to the whole school activity model in the form of the Spark schools. So just a fantastic opportunity for us to be in Lawrence, and we are grateful. So please welcome Deputy Superintendent Seth Racine.
Thank you, everyone. Again, I send my apologies from Superintendent Jeff Riley. He was unfortunately able to be here. So for those of you who wanted to come to listen to Jeff, now would be the time to get a coffee or use the restroom. And thank you again to Paul Grover and the Boston Foundation. You've been a partner since the beginning of this turnaround effort, and we have always appreciated your support throughout all of this effort. So just to give people a little bit of context, right before receivership began in the Lawrence Public Schools, 1 out of 2 students graduated within 4 years. 2 out of 5 students were proficient in English language arts, and 1 out of 4 students were proficient in math. Yet when Superintendent Riley came in, he knew it was not just, he had to support the whole child. And so he's instituted a number of new initiatives, including providing universal free breakfast and lunch across the district, bringing back intramurals at both the high school and the middle school grades, and also extending the day as a major key initiative. And so now all of our elementary and middle school students go to school every single day between 7 hours and 10 minutes and 8.5 hours every single day. This has allowed leaders to be able to work with their teachers to create schedules where they now have time for intervention blocks for their students. They now have time to collaborate and plan with their teachers. They now have time to be able to work during the day with partners such as the Boys and Girls Club, the YMCA, Playworks, and other partners to be able to give many, many experiences for high quality enrichment for these students. And our efforts are working. After 2 years, we are arguably the most improved district across the Commonwealth, where we've tripled the number of level 1 schools, the highest designation in the state, from 2 to 6. Our math proficiency is at historic levels, increasing by 13 percentage points. English language arts has increased by 3 percentage points. And our graduation rates and dropout rates are at historic levels. But Every year, we have an opportunity to look at what we're doing, examine, and adapt. And so thank you to the Boston Foundation, thank you to Tufts University for highlighting this. Principals work with teachers in their school to create and design the schedules that best meet the needs of their students. Every school is different, and we were able to provide and support them through that. And so it's not just about how every student is doing on the MCAS, but they're able to now look at what opportunities do these students have for arts, music, dance, and as highlighted by this report, physical activity. So we are really fortunate for this opportunity with this report. And the foundation of the Lawrence Public Schools is really about empowering schools to be able to design the type of school that best meets the needs for their students. And it is a great honor here that you have invited Colleen Lennon, the principal of the Weatherby School, one of our level 1 schools. And I just want to highlight that a little bit. It's mentioned a little bit in the biography, but just to show you how impressive Colleen and her staff have done to create the type of school. The state uses a thing that they refer to as school percentiles, where they look across multiple years at every single school for MCAS scores, looking at growth as well as proficiency rates, and ranks schools across the state in terms of their grade span. And the Weatherby School is it's a K-8 school of over 700 students, 91% low income, 68% of these students, their first language is not English, and 28% are English language learners. Yet when measured just on scores, just on performance, not taking into consideration any of the demographics, the Weatherby is in the 50th percentile for the state. So at the state average, based on how these students are performing. It is really an incredible feat by Colleen and her staff, and I am excited that she is on this next panel. So with that, I want to thank again Tufts University. I want to thank Boston Foundation for this.
So welcome and good morning, everyone. I'm Allison Bauer. I'm a director for health here at the Boston Foundation, and I'm really pleased that you're here for our second forum for our centennial. We were just nosed out yesterday by our education colleagues who had the first forum, who warmed up the room for us, and the subliminal message of the importance of health and education was just come across the screen as you saw their slides popped up again, because their presence was still in the room. Today's forum, however, is very well aligned to follow yesterday's presentation because the case study that you just heard Dr. Sachek present addresses, as Mr. Gergen said, as Paul said, two of the most important priorities of the foundation, health and education. I want to just, before I proceed, thank Deputy Superintendent Racine for being here and for his comments. The Boston Foundation has really taken a very significant stand on the importance of physical activity in schools. As Jen Sachek mentioned, in 2008, the U.S. Department of Health and Human Services recommended that children and adolescents get 60 minutes daily of physical activity. With 95% of children in school 6 to 7 hours a day, to be able to get those 60 minutes in, obviously, some of that has to happen during school time. However, there are very few schools that offer daily physical education. Nationally, 4% of elementary schools, 8% of middle schools, and 2% of high schools, according to the CDC, offer daily phys ed. And in Massachusetts currently, only 16.7% of youth engage in daily phys ed compared to almost 30% nationally. In fact, in one study in 2011, the Trust for America's Health put out a report that showed that Massachusetts actually had the lowest percentage of students physically active 60 minutes over a 7-day period at 17%. Now, we're used to, as a state, being at the top of charts, not at the bottom. So this is a particularly embarrassing thing, I think, for us. And in the absence of that kind of regular phys ed, we need to find innovative ways to bring physical activity into the school day. What's particularly important about that, as again, as Jen Sachek highlighted, is that kids who are physically active typically perform better in school. In 2013, the Institute of Medicine issued a report that said children who are more active are more attentive, they have faster cognitive processing, and they perform better on standardized tests. So with that, I would like to invite our panelists to come up to their seats. You have full bios at your chair. I will do a little bit of an introduction of each one. Feel free to come up while I'm talking. We've got Senator Tom McGee. We have Colleen Lennon, the principal from the Weatherby, Max Fripp, Executive Director of Playworks, and Megan Block, Charitable Programs Manager from New Balance. Senator McGee, the farthest from my right, serves the 3rd Essex District, includes the communities of Lynn, Linfield, Marblehead, Nahant, Saugus, and Swampscott. Senator McGee has been Transportation Committee since 2003 and is the Senate Chair since 2010. He's Vice Chair of the Joint Committee on Economic Development and Emerging Technologies and a member of the Senate Committee on Ways and Means, Committee for Global Warming and Climate Change. He's also currently co-chair of the Mass After School and Out of School Coordinating Council, Metropolitan Beaches Commission, and co-chair of the co-chair of the Northeast Legislative Caucus. In October of 2013, he was elected chairman of the Massachusetts Democratic Committee. Prior to his election in the Senate, he served in the Massachusetts House, as well as practicing law, and served as an assistant DA in Essex County. Colleen Lennon, as we've heard about, is a principal at the Weatherby. She's a native of Providence, Rhode Island, began teaching in 1982. Obviously, she was a child teacher. She started as a grade 3 teacher, came to Massachusetts and continued teaching in Lawrence, and in 1986 brought her to the Lawrence Public Schools. She taught earth science, grades 5 through 7. Having 2 7th graders, I'm very, very sorry about that, for 10 years, and then has gone on to do a master's degree in educational leadership, served as assistant principal for 2 years, and was appointed principal of the newly renovated K-8 Weatherby in 2003, where she continues today. As we've heard from Deputy Superintendent Racine, under her leadership, that school is now a level 1 recognized school and has attained an overall rating in the 50th percentile, among the highest when compared to other similar urban schools. Max Fripp is the executive director of Massachusetts Playworks. In his 6 years in Playworks, that program's grown from 14 Boston schools to a statewide movement, partnering with 40 schools across the state, including 24 in Boston and obviously schools in Lawrence. Prior to his time at Playworks, Max spent 4 years at Citizen Schools, where he served as an AmeriCorps teaching fellow. He actually lives in Boston, and his son, Xavier, is a student at the Sumner School, which is, in fact, a Playworks school. And finally, Megan Block is our charitable programs manager at the New Balance Foundation, where she's been for 11 years and worked in tandem with Molly Santry to drive sustainable change among children and families across the nation. Since its establishment in 1981, the New Balance Foundation has distributed more than $65 million to local nonprofit organizations working to improve health and well-being of children and their families. In addition to foundation work, Megan also manages New Balance corporate giving and helps drive the company's global cause platform, which is called New Balance Spark Start. She serves on the board of the Arlington Boys and Girls Club, as well as the boards of the Presentation School Foundation, St. Patrick's School, so obviously takes her passion for both exercise and learning outside of her work. So with that, I'd like to move into some questions for our panelists. I'm going to start with Senator McGee. So, Senator, you've been a big champion of increasing physical education and activity in schools for a number of years. And in the past, you filed legislation to achieve this goal. What was it that made you become such a strong believer in this issue? And also, what challenges have you faced in trying to push this issue with your colleagues?
Well, I'm going to be filing legislation again this session, which is great, and which would mandate a
You can clap for that.
which would mandate 150 minutes a week for elementary school children and 225 minutes a week for middle and high school. I think the report is excellent. Was not surprised at all at the results, and I actually got started as chair of the Children's Caucus in the Senate, and then as we created the Committee on Children and Family, really got involved in a lot of issues related to children. I have 16-year-old twins, so I got to ride that experience through as they were in elementary school, and hearing from my children some days where if a student in their class was causing some problems, the whole class didn't have recess. So I think we all face this challenge together. But I just want to there are many challenges, and I think when you talk about passing legislation and how do we afford it, and physical education in the schools, and I think the report we heard this morning from Dr. Sachek reflects that we need to focus on how do we push that agenda in schools. It's not happening. And if you look at some statistics, I think we need to continue to look at the statistics. 57% of high school students and 63% of middle school students didn't meet the requirements. 44% did not attend physical education at all during the school week. 82% did not have physical education daily. 38% had not been taught how to follow a personal fitness plan. 40% had not played on sports teams. 69% of high school students and 63% of middle school students did not walk or bike to school. 28% watched 3 or more hours of television. 32% of students do more than 3 hours of video a day. Where are they getting this opportunity? It needs to, the schools, we spend billions of dollars a year here in Massachusetts to educate our children. And if they're, and these, I think we've seen more studies that reflect that this investment has to be made, that we have to understand that an investment in physical activity and quality physical activity in the schools is going to enhance their ability to reach their potential. And we need to understand that as we're making these investments, we need to find a way to make it happen. Great things are happening in Lawrence. I think we have to build on that. And I do think that by mandating that physical education needs to be a part of every day for students, we can take a look at how we enhance that both in physical education, but more importantly, as part of the school day. So we need to work on it. I want to thank the Boston Foundation for focusing on this. You've had a number of forums on this. This is a huge issue, and I think together we can find a way to make sure that those students, all students across the Commonwealth, have the opportunity to excel. Physical activity is a key piece of their day.
Thank you very much, Senator. You're obviously very passionate about it. And I think it lends ourselves to a question now for Colleen, because you're talking about the importance in schools. So Colleen, as a school leader, what have you observed in terms of the effects on students when they have time for physical activity during the school day versus when they don't?
I would say that probably PE is probably the favorite part of their day for a lot of them. What's your favorite class? PE.
It's a little sad, actually.
Yeah, it is a little sad. We have 2 great phys ed teachers, so, and they've done a lot of work with the teachers of just not having phys ed, how do you bring it into the classroom? So they've gone to the Department of Ed, fit math training. They've turnkeyed that to the teachers. They've asked teachers, you know, in the confines of your classroom, when you're teaching mathematics, how can you incorporate some physical activity so they can get up and they can spend time. So they're definitely happier. I'm a little concerned about the disparity between boys and girls. The boys want to play basketball at recess. I will tell you, we have PE every day. We do have 706 students. We have recess every day, K-8. They have 10, 15 minutes they need to get outside and move around. So we need to do a better job for the girls, obviously. They would rather stand and talk to their friends than go and play basketball at recess. So there's lots of creative ways that at the school level we can do that. Thankfully, Superintendent Riley has carved out money. So since the report, we've seen an increase. There's lots of programs that we're doing. And they love to be out even when it's 35 degrees out.
Well, that's convenient, seeing as we live in Massachusetts, and
Yes.
it's often 35 degrees out. You talked about the importance of recess and of engaging kids at recess, which I think lends us to a question now for Max. Playworks is often cited for its work helping get kids active during the school day. Maybe you can start with a little brief description of your model and how it works, and then also how it's specifically working in Lawrence.
So thank you. Playworks has 2 ways we engage with schools. One is we place amazing full-time professionals. Kids call a coach in a school. They're there Monday through Friday running our full-day program. The other is through training and building the capacity of schools to do it on their own. Our full-day program with full-time Playworks coaches is pretty simple. They're there Monday through Friday in and out of school running 5 program components. So the first is recess. We make recess a safe, inclusive time for every kid to feel part of the game. We run a classroom component called class-based action learning, where we work with the classroom teacher and do a 45-minute lesson plan using play and kinesthetic learning to develop social emotional skills, conflict resolution skills, and reinforce academics, all through movement. I was at a classroom-based action learning at the Blackstone yesterday, 45 minutes, and the kids and the teachers were moving and playing together. It's really powerful. We do a youth leadership program for 5th graders where we're empowering these kids to lead games and resolve conflicts for their peers and younger students at recess. And then at night, in the out-of-school hours, we do sports leagues throughout the year. So we just finished our girls' basketball league. And it's quite alarming, folks. Here in the great city of Boston, 82% of our 4th and 5th grade girls who play girls' basketball, it was their first time playing on an organized sports team. And we can do better in Boston, and we need to think about that. So that's our model. And I'm going to share real quickly, it works. We have a random control trial that we conducted, thanks to Robert O. Johnson Foundation. And 3 really amazing things came out that I think add to why physical activity and recess matters. One is we had one of the largest reductions in bullying that they've ever seen in a random control trial. And we don't call ourselves an anti-bullying program, but we know that kids get bullied at recess. We had a 14% increase in vigorous physical activity at recess. And the third that was really amazing was that teachers in Playworks schools gained 23 hours of teaching time. That's about a week of instructional time in a school, and that's a key measure to turning around schools from a level 4 school to a level 1 school. So we're really proud about that, and the nimbleness of infusing physical activity throughout the school day.
That's great, thank you. So Megan, I would love for you to be able to talk about and expand on New Balance philosophy in terms of working with the community, and then specifically why the New Balance Foundation was interested in funding work within Lawrence.
Yeah, I think that's great. So I think it's important to just kind of dial it back. Like you said, New Balance continues to be a private company. A corporate foundation was established in 1981 by our owners, Jim and Ann Davis. And the idea behind that was to say, we believe in giving back to our communities in good times and bad. And we will do that until forever. So it is an established foundation. So in 1978, New Balance opened its doors in Lawrence. 1981, New Balance Foundation was established, and we said we need to give back to these communities. Lawrence is a city that's hosting us. We currently have 800 associates working out of Lawrence, and 30% of those associates are living in the city of Lawrence. So as a company, we really feel like we're part of that fabric of the city. So I think Molly and I would say we both started at the foundation about 11 years ago, and at that time there were 1 or 2 organizations working with children that were really looking to make sustainable change and really take a hard look at children's health and wellness. And we went, I'll plug the Lawrence Y. We were attracted to the Lawrence Boys and Girls Club and Lawrence YMCA, and we were attracted to these programs, and we said, these guys understand. Lawrence Boys and Girls Club was really looking at how to impact the whole child. And what we've seen over the last decade, which I think is so encouraging and why we continue to be drawn to Lawrence and we continue to have this great hope for Lawrence, is that there are no longer 1 or 2 organizations. There are many organizations working with children and working with families and then working together, and they're collaborating. So they're taking kind of the strengths of their own organization and bringing it to others. And I think that collectively, all of these organizations, we're working with dozens of them now in the city of Lawrence. They're working together to change lives, and they're really coming back to the Lawrence schools now and saying, how can we help you support these kids? You're doing a great job. We understand what your strengths are, and these are the strengths we can contribute to change these lives. And I think, again, we respect all of the organizations out there and all of the schools. We're not in it day to day, but we believe so passionately in what you do. And again, I think we're invested. Our associates are there, our business is there, and we really do believe that Lawrence can turn around.
That's great, thank you. So I'm going to go through some more questions for the panelists. I would also encourage the panelists, feel free to comment on each other's answers and if something moves you. So Senator McGee, while I am truly now knowing you have 16-year-old twins, moved to ask you about them, perhaps we can do that afterwards. But what I would like to know, and this was referenced earlier, is that we talked about the fact that Massachusetts has physical education standards, and that those standards had been in place for some time, and then there was this move to, if you will, relax them, take those minutes away. I'm curious what you might attribute to the relaxing of those standards. What was it that caused that pullback from the emphasis? I mean, obviously, again, we've heard the Weatherby has recess every day, or PE and recess every day. If that were the case in all of our schools, maybe this report wouldn't be necessary. Maybe the statistics would look different. What was it that caused the relaxing of those standards, do you think?
I think you need to go back to 1993 and ed reform and the whole reinvestment in public K through 12 in Massachusetts, and the focus on testing and curriculum and MCAS, and to really build a great system. And what I think got lost in all of that was the focus became so more clearly on that piece of it, the educational piece, obviously math and English and MCAS scores and testing and how the school systems are doing. And we lost sight of, during that period of time, that physical activity and phys ed is a key piece. And I think the studies really more and more reflect that that should be a piece of it. But as we move through and we're investing substantial amount of dollars in the 90s into the schools, there was the recognition that more time needed to be put in the schools on math and English. And so I think in the late 90s, the minutes were eliminated. So in other words, we still mandate that physical activity needs to be happening in the schools and it needs to be part of the curriculum, but we eliminated the time frame, and what it allowed districts to do was take the focus more and more away from the physical activity, to the point where over 50% at some point over the last several years do not at all offer physical activity. Some schools are eliminating recess because the time frame and I think the stress of making sure that the MCAS scores and the levels of the schools stay high, and all of these pressures have allowed people to make decisions, I think, without recognizing the impact of those decisions as well. And I just want to make a comment, because more and more I get involved in this, I'll wear my after-school hat in some respects. I was talking a little bit about it earlier, but the partnerships and the opportunity to create partnerships as we talk about after-school programming with Boys and Girls Clubs and YMCAs, and starting to build these relationships so that the school day is more than just the 7 or 8 hours. It's 8 or 10 hours with some of these after-school programs and opportunities, and that physical activity piece can be part of that as well. So as we discuss these issues, they really begin to overlap. So I know it's a little off topic, but in many ways, there's great opportunity to build, and that's what we talk about in after-school programming. How do we build the partnerships between the schools and the local nonprofits that are giving kids opportunities that schools maybe aren't giving them right now?
With that, I'm actually going to jump a little bit out of order and jump right to Max before I come back to Colleen. Just because I know that Playworks has been trying to do some partnership with out-of-school time programs, and I'm curious, Max, whether you want to share some of what it is that you're thinking about to speak to the point that the Senator just made.
Well, first, I applaud Senator's work on the state level, and I applaud Mayor Walsh and his leadership team to work with our teacher union to expand the day in Boston. I do think there needs to be a firm stake in the ground that as we expand learning time, there's got to be at least 30 minutes, and I think we need some strict rules around that. We've seen that one of the biggest barriers to really getting great physical activity in the out-of-school time sector is training staff, actually not about leading the games, but around behavior management and group management. So we've done some work. We've developed a 8-hour training for out-of-school time providers called the After School Academy. Thanks to the Boston Foundation, we trained a bunch of Boys and Girls Clubs and YMCAs here in the city of Boston to really empower them to get kids moving. We teach about games and game facilitation, but ultimately it's about the behavior that often gets in the way, and it's the same thing as the school day. The kids misbehave, and they're crazy, and they get hurt, so we take it away, and then they sit in their desks more. So we really care deeply about making sure that out-of-school time providers do have the skills to lead really safe and healthy play in and out of school.
Great, thanks. So doubling back now to Colleen, I think you started to mention this a bit, and I'd love to get you to expand on a little bit more. But as a principal, what you saw in terms of changes in the district and how it's affected students' ability to receive physical activity, and that could be both declines and then the increases, and those kinds of changes that you saw happen.
So I've been in Lawrence, as you can tell, for a very long time. And when Superintendent Riley came to the district, he thankfully implemented intramurals, so we probably service over 2,000 or 3,000 students in their intramural program. So it allows middle school students an opportunity on Saturday, instead of sleeping or watching TV, they have practice after school. So I think the money that he's allocated in our budget for that has been critical for our students for a lot of reasons. It's really been a help, and we at the school level, excuse me, because we have autonomy as a level 1 school, we're able to look at our budget and funding and determine, what is it we want to spend some of the money on, and who do we want to partner with, what high-quality partners. We partner with outside agency Squash Busters from Boston, the Boys and Girls Club, Beyond Soccer. We have a karate person come in. We have a dance teacher, a yoga teacher. So had that money not been earmarked for our students, I don't think that we would have at the present time kind of seen the increase in when kids are active, they feel good about themselves, which in turn is going to affect them positively in the classroom. We have a little issue going on here because our job is to educate students and get good teachers. And if you ask a teacher what's more important, math instruction, science instruction, ELA, or by the way, can you do a little bit more time with some physical activity? It has to be a balancing act, and we're always trying to get better at balancing, and it's not an easy thing. And similar to PlayWorks, we have to create creative ways that kids can get involved in. Quite honestly, money, budgets, funding, schedule, it all impacts what we're able to do at the school level.
So I'm going to come back to a question there, but I want to go back to Megan. We mentioned the New Balance Spark Start. That initiative. And I'm curious if you could talk to a little bit about what the initiative is, how you launched it, its goals, and what response you're seeing from that.
Yeah. So again, New Balance Foundation was established in 1981, so we've been able to contribute, as you said, Allison. Right now, it's over $72 million to the local communities. And so while that's great and it's a nice effort, we really saw this opportunity to talk about not just New Balance Foundation, but New Balance as a whole, and to bring together our corporate culture, which was one of giving back. So we give back through volunteer hours and also through cash donations. And it's not just New Balance Foundation who's distributing cash, it's the company as well. And so it was this idea that said, we have no intention of tooting our own horn. We're not the ones doing the great work. It's all of these great people on the ground. But what we do need to do is bring attention to kind of what's going on and kind of the state of affairs. And so what we did was we brought together all of our philanthropic efforts, and we said as a company and through these efforts, what's clear is that we believe in children's children's health. So through physical activity and nutrition, we can really kind of elevate these kids, and we want them to have healthy and active lives. And our product supports that. We create shoes that help people run faster, further, more efficiently. And so how can we use this product? How can we use kind of our platform to engage kids and to support local organizations? And so Spark Start is just that. It's how do we ignite a child's movement spark? And we always use this example as the first crack of the bat that engaged this young girl or young boy in the passion for baseball? Was it watching a track event that got them to love running? And what is that? And it doesn't always have to be physical, but it has to be something that they love and that they believe in, and we feel like if that can happen, then they feel good about themselves and they want to give back and they want to move and they want to learn, and really it contributes to kind of this idea that we have of really fostering and working with the whole child. And again, we do that through all of our great partners like PlayWorks and through the school. So
I'm curious, do New Balance shoes actually make you run faster? Because
They
if that
do,
is
Allison.
the case,
They do.
I just
They do.
got my pair in the mail yesterday, so I'm
Okay.
going to have to test that out.
Yes.
Can I add to that?
Absolutely.
Prior to the superintendent coming, we were trying to figure out ways that we could get kids to be more active, and we reached out to New Balance. We got a small grant through the Merrimack Valley Running Club, and the 2 PE teachers decided we'd start a running club after school, and they needed sneakers, and so we contacted New Balance and readily, gave us the sneakers for our students, and so that's been a really great partnership for us at the school level, and I know you've reached out to other schools as well. So
So they do run faster.
They do run faster.
They do run faster in New Balance
I
sneakers.
told you that.
Ask the middle school boys that.
Yeah. I think just one thing to build on, I think, again, as a foundation, it's difficult for New Balance to work directly with the schools. I think we see partnership as very important, and that's what sustains our programs. And so And so it's great when we can work one-on-one with some schools, but we use Playworks as a great example. Playworks is this incredible vehicle that impacts schools across the nation. And so while we can have this tremendous partnership with MAX, and we can look at how do we help MAX kind of get Playworks to evolve, how do we help MAX to reach more schools and more students, MAX is out there every day with the rest of the Playworks group, and New Balance Foundation, instead of impacting 300 kids, can help to impact hundreds of thousands of kids. And I think we take a lot of, we're really excited about that.
So I have a question I'd like to ask, and I'm getting them warmed up. The audience, hopefully you have your questions that you're waiting, and you will have your opportunity. But one of the things that I've been struck by, actually, so in the time that I've been here at the foundation in the last 5 years, where we've been focused on this issue of getting people more physically active, getting healthier foods to people, really driving to address this obesity epidemic that Paul referenced. We have found that with all of the great research, the work that Jen Sachek's done, the work that her colleagues have done, the other research that exists, the IOM reports that we've mentioned, the work of Robert Wood Johnson, we still face an awful lot of resistance. And I think, Colleen, you just mentioned that. You know, you have to massage that message with teachers. If you ask them, what should we be doing? And should we be having more classroom time? Should we be having more exercise time? And I think that the question I have is, I'm curious to hear from all of you, what is it that we should be saying? How should we as the Boston Foundation be crafting the message, and crafting the messages to the different audiences? The messages to teachers, to administrators, to policymakers, to your colleague, Senator McGee, that this actually matters, and it matters towards both health and education outcomes. So I know that's not one that you've necessarily been prepped for, but it is a really big question for us in figuring out how we are going to be able to be successful in helping you, Senator, pass your legislation, in helping you, Colleen, work with your teachers to have the buy-in, and in helping with Max and Megan and the work that you guys are doing to expand this effort. How would you help us craft that message to those different audiences?
So a piece I think that's missing is the parents. That's huge. You also have to message to the parents. We start with the students, you know, to educate them and have them realize, like, this study has brought an awareness to those students of how important exercise is and activity is. So the hope is that they're going to message to their parents now. And how do you do that? So I think outside organizations, we've had UMass Boston Nutrition Program has come in and done workshops with our parents. There's lots of layers to that messaging, and it's not just at the school level as well. So.
I think we all, whatever the issue is, you always have, what's the goal? The goal is to make sure we give every child in Massachusetts the opportunity to reach their full potential. And what involves that? I mean, I think we all know it without even the studies. You know, they have access to a good school, to good teachers. They have access to physical activity, after-school stuff that they can do. I mean, there's so many things, you know, what you want for your children. And all of those pieces are a part of how we get there. And so the education piece is so teachers understand what is going to allow me to be the best teacher. Physical activity in that classroom is going to allow me to have my kids score high. Opportunity to have a good meal in the morning, in the afternoon, and at night. I mean, the thing, you know, access to an after-school program that engages them in a way that you don't in the classroom, that you can in the classroom. I mean, all those pieces are a part of young people reaching their potential. So it's building that message towards what the goal is. And so each piece is a key point in that. It's like when you're building an economy or trying to grow something in your community. There's all the pieces come together. You can't just say, let's build housing and we're going to have a great community. There's how do you create jobs and transportation. All the pieces are how you build to where you want to be. It's the same with what we're doing here. And I think the more that the studies reflect that, and it is the parents. It is getting parents to understand that as well. But it's getting all of us to understand as we move forward as a Commonwealth and we build policy, that all the pieces need to be a part of that. That's where the success comes. And so we have to continue to talk about it and educate people.
Three areas that I think are important. I reference our random control trial, which Robert Wood Johnson paid for. One is that great physical activity enhances classroom learning. It creates the conditions for teachers to do what they do best, which is teach. And so to me, that's stuff around teaching kids the social skills to mitigate their own behaviors and resolve conflicts. Giving kids the opportunity to engage in activities so that they know how to engage as a scholar in a learning community. And I think that's really important to moving the needle in academics. The second is school culture. I fundamentally believe, and I'm sure there's research out there, if kids don't feel safe and included, they will not learn. If they're dealing with what's going on in the neighborhood, at home, what they have to walk through, that they're getting bullied throughout the school day, that is one of the biggest barriers to learning. So if we can create cultures where every kid feels safe and included and ready to learn, we'll move the needle. And the third area that I think is really important are pushing on our schools of ed to rethink how we're training the next generation of great teachers. Right now in Boston, we have 38 Playworks alumni teaching full-time in Boston Public Schools. That's more than a quarter of our alumni, including 6 at Up Academy in Dorchester. We need to make sure that teachers are trained to teach in a 21st century context. And I don't think we've worked with schools of ed to do that. I think part of it is the difference of teaching versus facilitating. How to lead movement breaks, or minute moves as we call them at Playworks, is really important. I think schools of ed are a little behind on kind of meeting this demand.
That's great. I mean, from a strictly business perspective, we're educating the children that we hope to bring into New Balance someday, and we want confident kids or young adults who feel good about themselves and who want to give back to the community and who want to create products that are going to create change for other people. So I think we're invested in these young people. We want them to be part of our team, and we want them to help us change the lives of others.
So I know you've all been sitting out there and you're nervous that I'm going to make you do a physical activity break because, in fact, that's what we tend to do at our health forums. But I'm not going to do that. As long as you promise you're going to go out and be physically active at the end of the day. So we are going to turn it over with that to the audience for questions. I will ask a couple of things of you. I would ask that you refrain from making speeches or statements and try to focus more on questions. It'll give us a better opportunity to have more questions asked. Also, if you would introduce yourself when you're asking those questions, and there's some mics circulating, so if you would wait for the mic to get to you when you're speaking, that would be terrific, because then we are recording this and we can hear your question clearly. And also, I wanted to remind folks that in addition to asking questions of the panel, you can ask questions of Dr. Sachak. She is sitting here in the front, and she can answer more questions about her report if you have them. So with that,
Thanks very much to all of you. My name is Wendy Landman. I'm the Executive Director of Walk Boston, and notwithstanding our name, we actually work all over Massachusetts on walking advocacy and getting more people to walk more. And one of the things that we've done a lot of is Safe Routes to Schools programming, which is to get children out of their parents' cars and onto their feet walking to and from school, and have had some significant success in a number of communities. And I'm wondering whether in the research or at your school, whether you have looked at how children are getting to and from school and whether that has an impact on some of the same pieces of physical activity, and maybe to Max, whether Playworks is thinking about that connection, that out-of-school connection. What we've found is when children are walking, actually their parents and other members of the community are walking more as well. It's sort of like a whole community approach, but based in the schools. So, thank you.
We are a safe route school. We are neighborhood schools, so all of the students in Lawrence are housed in neighborhood schools, with the exception of maybe some special ed students might be bused in. So they walk to and from schools, and it was interesting when I talked to some of the PE teachers about the report and the disparity between girls and boys. Girls come to the office, "Hi, Mommy, can you come pick me up? I don't want to walk home." Boys walk home, go out and play basketball, go to the boys' club, so we are a part of that program.
I saw a hand over this way.
So, Mike Took from Boston Leaders for Education. This is a question, I think, for Jennifer, because I've been involved with Spark a fair amount. As I understood the data, Spark Daily has something like 40 minutes of time for active work during the school day, but they have 2 50-minute blocks. What happens to the rest of the time?
It's a great question. So that could be active time, that might be captured more in light intensity or even sedentary. I think that they are more active. They might have time allocated, but it doesn't mean they're all engaged. And I think that's important. So I think a key example is something I did a long time ago, looking even at a sports practice. You think your child goes to play soccer for an hour, where in essence maybe about 17 to 20 minutes of that time is actually moderate to vigorous activity. So sometimes we overestimate our level of engagement, and I think that's something we have to think a little bit more critically about in terms of making sure, like PlayWorks, like engaging all children. And I think future work will also highlight lighter intensity activity, because I think that's also beneficial. Getting them up, is probably first and foremost. Getting them, move them to light. Optimal will be moderate to vigorous. Yeah, thank you.
There are a couple hands right behind you. First the back, and then.
Hi, good morning. My name is Maddie Ripple with the Massachusetts Public Health Association. Thanks so much to all the panelists. I have two quick questions. First for Max. You mentioned that some of the research showed that your programs had increased the number of hours that teachers had in the classroom or learning time, which is sort of counterintuitive, and I'd love to hear more about that. And then to Senator McGee, we so appreciate your leadership on this issue, but it's been so hard for all of us who care about this to make progress. What do you need from us as your partners and as advocates to help you get this done?
You want to go first?
So on the recovered hours, there are two big drivers of that. One, the transition from recess to when classroom instruction happens. In PlayWorks schools is 5 minutes faster every day. So the observers from Stanford and Mathematica literally had stopwatches, and when recess ended, they'd go back. And then they sat in the classroom throughout the entire day. And one, as most of us would think, there's more focus in PlayWorks schools because the kids are getting more daily physical activity. But the other that was really fascinating was there's more cooperation, right? So if you talk to a classroom teacher, they spend an amazing amount of time dealing with kind of Max and Megan fighting about who's going to present or use the markers. PlayWorks schools, we teach the kids how to deal with that. And so the teachers are really doing teaching time. And that's where that came from.
In terms of how you can help, I think reaching out to local legislators, letting them know that this is an important piece, and I think having a large crowd at the hearing. There's a lot of people, I think, that are here and that are watching. Come to the hearing. If we have 500 people show up at the hearing, doesn't mean you're all going to testify. It definitely sends a message that this is important and people are watching. And I think continuing to educate teachers, parents, school districts, with legislators, with local elected officials, using the reports that reflect how important this is. And building a consensus where people start to say, we need to do this, and working within our communities. I think everything is local, so starting at the local level and making sure that legislators, that all of you are in your districts, understand this issue is an important piece of what we need to be working on as we work into this legislative session. But being part of the process, reaching out to legislators, coming to the hearing, written testimony, and continuing to highlight how important this is.
So, right here in the center.
Hi, my name is Michael Yogman. I'm a pediatrician and board chair of the Children's Museum. Three quick comments. One is a big issue for us as pediatricians is grappling with some of the most sedentary kids are sitting at home playing video games. And the competition between the attractiveness of video games and physical activity is a huge challenge. And I think we need to encourage, you can use video games to encourage activity. So that's a challenge for all of us. The second thing is there's a very innovative program at Leslie that we're partnering with called Sidewalk Math, particularly for girls that struggle with math. It might be an interesting way to address some of the data about a kind of hopscotch and learning math at the same time, so it doesn't have to be an either or between activity and education. And finally, as a pediatrician, you know, the striking increase in especially boys, but kids with ADHD and the overuse of prescription medications, as pediatricians, and I wondered if you could look at this in your data, Jennifer, I guess that's my question, we ought to be writing a prescription for exercise instead of for medications.
Can I respond to that?
I'm going to let Jen respond and then to you.
I know there's a huge initiative through the American College of Sports Medicine called Exercise is Medicine. I think they are handing out tablets to prescribe physical activity now. But I do think that, you know, just highlighting that importance is definitely key. And if you can do that as physicians, I mean, I can be a researcher all day, but they're going to go to their MD, their pediatrician for advice. And so raising awareness amongst physicians, I think, is key, both on nutrition and physical activity front, because maybe, back when they were trained, it wasn't at the forefront of everybody's minds. And now in this day and age, I think it's critical, because that's where they get most of their advice. So please, thank you for doing that.
I think Max also has a couple of comments on that one.
Our AmeriCorps members do this amazing service project called the Family Play Academy, where we empower families to play together in their living rooms, in their backyards, and demystify the idea that you have to have a fancy gym membership or fancy facility. And we get people sweating in their living rooms. And we've worked with Boston Medical Center and some other health providers to do these in the community setting. We would love to work with you. We do it for free thanks to our commitment to service. And it's really powerful way to get families. And I actually fear the movement to using video games because I actually think organic play not just is good for our bodies, it builds healthy families that know how to interact and play together and be loving and joyful.
So I think there's some in the folks in the back who have, yeah.
Hi, I'm Lisa Doucette. I'm a volunteer with Greater Lawrence Community Boating Program. I haven't heard it mentioned here this morning, but we do a variety of programs in the schools in Lawrence, and we bring in some ergs and have the kids do some indoor rowing league stuff, and New Balance has helped funded that. Our issue is a space and bringing things into the schools, and where we can find a way to, we have a waiting list of middle schools and elementary schools in Lawrence for this program, and I was just wondering if there's any insight on how you can get through to the school administration in order to broaden the program that we have.
Well, they can contact me because we have ergs and we row. My brother's a rower, so I'm an advocate of rowing. It's probably the hardest thing that you could ever want to do in your life, as I'm sure. He took me to rowing camp one time. He said, this will be a great experience. It was like a cult. So I think if you have schools talk to other schools about the importance of activity, and space is an issue. I mean, we're lucky we have a facility that we can house some ergs, and the boathouse is right around the corner from the Weatherby School. So I think administrator, just that contact of how much the kids love it. They love the rowing. The river is a great asset in Lawrence. It's underutilized. It's a gem. So.
Right, we have a master's program if you want to come on down Monday and Wednesday
I
night.
was the video of how not to row. Daddy videotaped us, and at the end of the week, this is what you should not do.
There's a little bit of a theme here with our forum today. We have, in addition to Colleen, obviously now that I know you're a rower, that was not in your bio. Jen Sachak, our researcher, is a competitive rower, as is Mary Jo Meisner. So we have a little rowing cohort. I wanted to give Seth Racine a moment to also reply to that question about the Lawrence and the resources.
Sure, thank you for raising that. It's definitely a challenge we have at the Lawrence Public Schools. We've actually invested over $3 million over the last couple of years into our buildings after years of deferred maintenance. And also another challenge we've had, both in terms of having buildings that range from being constructed 6 years ago to 1880, is that we have a growing enrollment population. Just a couple of years ago, we had around 12,900 students. We're now over 14,000. And increasing, we actually anticipate that growing above 15,000 in a few years. So as we have improved, more people have returned or are staying within the system. And so not only are we constrained by the facilities we have, but also the students who are coming too. So thank you for raising that. It's definitely a concern on all of our minds.
Could I?
Absolutely.
I'd love to make a point on that. I think it's a great point, and in some districts, the schools, and we talked about this, I think, the other day, the school doesn't have a gym, it doesn't have space for this, so that's a problem. And then in other communities, as we're making investments for school building assistance, some schools are being built in communities. It's the biggest public building that will ever be built. They're building high schools with not only gymnasiums, but with tracks and field houses. And the question is how do we maximize all of the resources we have? So where do you build a partnership so that you bring a rowing program into a new school, or you have YMCAs, boys clubs, girls Inc., whatever it might be, with facilities that aren't being used during the day. you know, we really need to break down those barriers and start to talk clearly about, again, as I talked earlier, what's the goal? Everybody's in it to enhance the children's opportunities. We need to have those walls broken down. That doesn't happen easily in school districts, and facilities are really a challenge. But we need to make sure if those opportunities are there, we got to overcome the barriers and get people talking and using facilities in communities for all students to use throughout the day. And so I think that's a real challenge, but there's opportunity if we think outside the box.
Yeah, just to build on that, I think it is a really good point. We were actually at the Lawrence Boys and Girls Club about a month ago, and it was a morning meeting, and the first time in 10 years that we've been there, the building was full. And we were like, Marcus, what's going on? He said, oh, we have this great partnership with the Lawrence Public Schools, and these kids come and use our gym, and we love it. And it was this terrific model where the Boys and Girls Club can actually now provide full-time positions there. So everyone's receiving benefits. They're no longer part-time jobs. These people are working from 9 to 7 or whatever it is. So it's terrific for the Boys and Girls Club, and it's this great resource for the schools. And it was just an excellent example of how a partnership can be mutually beneficial.
There are a lot of hands, so what I'm going to do is say from the far back first, then coming forward, there are 3 folks, and then moving this way. So there are about 5 people that are lined up for questions. Go ahead.
Thanks. I'm Pam Hess, and I'm with the Appalachian Mountain Club. And I just wanted to comment, we actually do run a prescription program to get kids outside and active called Outdoors RX. And we work with pediatricians in Boston, Chelsea Revere, and Metro West. But one of my question is, there's lots of great programs both out of school and in school. And one of the questions I have is, 1, how do we get more families involved? But 2, to the Boston Foundation or anybody, how do we do a better job of sharing the knowledge of all these incredible programs that I'm sure are here to make sure we all know what's going on as parents? I'm a parent of 2 elementary schoolers, but how do we do a better job of sharing these incredible resources and what's out there and getting those words out? Playworks is incredible, but it's not in all these schools. How do we make teachers and parents aware of what's going on?
I'm happy to.
Please, go ahead.
As part of the After-School Advisory Council, I was chair of the After-School Commission, and that was one of the key pieces. How do we let people know what's out there? How do we coordinate different programs happening in communities? And as we continue to build on this After-School Advisory Council, it's educating people around the Commonwealth about what's there and how do we interact together. So I think it's a great point. It's something we need to do so that whether it be Lynn Lawrence or Western Massachusetts rural areas, what's available? What's available for young families across the board? And so it's a great point. And so we're trying to build that in different areas, but it really is how do we get the resources together so you can, in one place, look at all the things you want to know about opportunities for your family. And the After School Advisory Council, we're trying to work in that direction with making sure there's training, quality programming, but also opportunities to know what is out there to take advantage of.
So we just recently had a ribbon cutting for our Family Resource Center. We have a new beautiful facility in Lawrence, and Raisa from the department is here. So there's lots of information there for parents when they come to Lawrence, and I think that if you have an information center, and it probably varies from district to district, where parents are, allowed an opportunity to come in and speak to someone and see what's available and what's out there. I mean, that's one vehicle which to get to the parents helps.
I blame myself for that lack of cross-collaboration in the field, and I think if a lot of us held up the mirror, we'd also blame ourselves. One of my goals for 2015 is to work more with other nonprofits and learn more. I think the challenge is we're doing a lot with little time, and then we often get together at forums like this or donor meetings. I think we have to make time to collaborate with our peers and learn from our peers. And it's really hard, and none of us do it enough. So I hope that all of us pick up the phone more and just chat and learn from each other, not when donors are bringing us together, because it's really in our court.
I will say from the Boston Foundation perspective on that, the one piece that we have at least been trying to do, and I know this forum's focused on Lawrence, but with our investment in Boston, Max is, and in fact Jennifer Sachak are part of a group that we bring together for all of the different physical activity partners that we've been investing in for the work in the Boston Public Schools. You'll be happy to know it includes community rowing, one of the rowing programs. It includes sportsman's tennis and enrichment center, as well as Playworks, as well as Box, a before-school program, and Child Obesity 180, and their 100-Mile Club, a running program. And we've been trying to get those different organizations talking to each other about the reach in the schools. And I do think it is a little bit of a district-by-district thing. Interestingly, by way of parallel, I have now, I think maybe in the last 2 years, Megan and Molly and I probably sit down every 3 to 4 months, and we check in with each other about what we are investing in and whether there are other programs that we should be looking at, and help inform each other. So I'm hoping that in our philanthropy, we're modeling some of that partnership and then taking that out to the different programs that we're working with. But it is, I think, a challenging and a difficult question. How do we get the information out? I know that, again, different schools do it different ways. There's various organizations that put that information out there, but informing parents to find it and them having the time to engage in it is a challenge. I know we've got more questions out there. There's somebody in red who's had their hand up a few times. Right?
Hi, I'm Margaret Riss. I'm with Karen Hill Educational Collaborative. I wanted to ask Senator McGee for the number and title of your legislation so that we can work with our own local people about that. I also wanted to bring up the issue of dance when we talk about children, girls who aren't that interested in movement. How about Zumba for children? How about some of the aerobic dance programs, even folk dance or cheerleading, just to open up that avenue for girls particularly? Thank you.
We actually do have dance, yoga, and cheerleading, and it really starts at kindergarten, to be honest with you, and they love that movement. A few years ago, one of our Latina teachers offered a dance class after school for girls who did not know how to merengue and salsa. It also included some staff members who did not know how to merengue and salsa. So, I mean, you have to be creative, but things like that are good.
It was just filed yesterday. It doesn't have a bill number yet. Senate docket 332. It's an act to promote quality physical education. We're hoping to get co-sponsors. It's a refile. So the bill number will be, the filing deadline is Friday, so we're still in the process of filing legislation. So the bill number will be available sometime in the next couple of weeks. Can reach out to my office, 617-722-1350. Happy to get you more details on that. Megan Hamill from my chief of staff is here as well. I've got a great staff that works closely with me on that, so please reach out and work with us. Thank you.
Great. Directly in front.
Hi, everybody. This has been fantastic. My name is Matt Meyerson. I work with the U.S. Fund for UNICEF. We're launching a program, Getting Kids Active. It's a physical activity tracker. We'll be with about 6,000 kids in the Boston area starting in March. Would love to learn from some of your experiences at launch, whether it's from a research standpoint or in terms of programming. What are some of the hurdles that you had to overcome and kind of advice as we go down that path?
I think launching is incredibly difficult. I think having clear contracts or a memorandum of understanding with each school about what you will provide and what they will do is really important. In your staffing structure, to have multiple checks and balances to figure out who's delivering and is there multiple feedback loops so that you have an opportunity to give feedback on the school on how they are or are not supporting, and likewise they have different opportunities to come to you to provide feedback on your delivery is really important. And then really knowing who is delivering and responsible for that. I mean, at Playworks it's quite easy because we have a full-time coach in most of our schools who we're able to control that. In our training schools, what we've done is we've created a recess team, which is actually a 6-person team who we're training and going in depth with, and then having a point of contact. So to me, when you're not there full-time, having really clear roles of who's doing it and then who you're communicating with is important.
Oh, I'm being pointed to someone by someone else, so I think that's probably a double hand up. So over.
My name's Betsy Nichols. I'm at the Harold Whitworth Pierce Charitable Trust. I realize that this is a school time panel that we're having, but I would remind people that to build the culture of physical movement, we really need to start from 0 to 5. And so in a next iteration, I hope that some focus will be put on that, and perhaps people are already, and I'd love to hear from anybody who is.
So if the panel would allow me to start answering that question, and then I'll hand it back over. The foundation actually agrees with you, and not only agrees with you, but we've made an investment to that end. We have recently put some dollars towards another researcher, Dr. Elsie Tavares at Mass General Hospital. And the work that she's looking to do is, actually it's a study called the First 1,000 Days Study. And first 1,000 days referring to conception to age 2. So not just starting with the children at 0, but starting with the parents when they are expecting, and with moms, with their first, the study itself is restricted to their first pregnancies, and working in a collective impact approach to bring together their OB, the pediatrician, the WIC programs that provide some of the supplemental nutrition for them, as well as home visiting programs, and to start the path right then of talking about both nutrition and activity and reducing screen time and the very choices that I think everybody's referred to on the panel. So it is a study that is just getting underway. We've just made the investment. It's designed to go for 5 years, where they're going to work in that first 1,000 days and then track the students so that when they enter school, we have a sense of trying to figure out whether or not there will be some change, and hopefully we'll see some change moving forward. So your point is both well taken, and one that we've started to put some attention on here already, and we're very excited about. And it's our understanding that Dr. Tavares also, I think, works with Pam Hess and with the outdoor prescription program as well. So some of those linkages, I think, maybe are happening, but maybe are not necessarily known to folks out in the community. I want to just open it up to if the panel has anything else they want to add on the.
Yeah, so Massachusetts is one of the areas we're innovating. We're one of the few, if not the only state, that has regulation that early childhood providers need to provide 60 minutes of physical activity. It's not, no one knows how to measure or track that. I would say thanks to the Boston Foundation, we are able to deliver really powerful training for early childhood providers at the Dimmock Health Center in Jamaica Plain. We gave them 16 hours of training on how to embed physical activity throughout the day. So not just the modified recess for kids, but how to use play and kinesthetic learning for transitions, and how to use play to get kids into circle time. And it totally has transformed their practice. So we're working with Commissioner Weber to kind of think about what would that look like to scale it across Massachusetts, because it's easy, but we have to give people the tools to do it in a way that demystifies it being really hard and difficult and costing money. So I'd love to see Massachusetts really move the needle on that front.
So this is the first year that we've added 2 hours of time to our kindergarten, so we're addressing the 5-year-olds. We've added 2 hours, and 1 hour is solely dedicated to exercise, and the other hour is dedicated to an enrichment activity. Teachers weren't too happy at first. We're going to have them for 2 more hours, but our thought was we would rather have them for 2 more hours and be able to do something really important for them than to have them go to a daycare that we can't control what's happening there. So that's been value added, and that's thanks to some grant money we received from the state.
Yeah, I think from a foundation perspective, again, we have a focus, and that's the prevention of childhood obesity, and we have a target age. But as I said before, we really believe in a holistic approach. So we have these terrific partnerships with community health centers and community organizations who are looking specifically at the 0 to 5 year range. They're working with expectant mothers to teach them about health and nutrition. And then with our community health centers in particular, we're working with those pediatricians to connect them with organizations that we have longstanding relationships with, and it's been extremely successful.
Probably have time for about 2 or 3 more questions from the audience. So in the greenish shirt right back there.
Good morning. My name is Joe Thibodeau, and I actually work for Sarah Barbara Italian, who represents the city of Lawrence and 3 other communities. I'm also a lifelong resident of the Merrimack Valley, and I think through that, that sort of inspires my question, and it's related to regional inequity. And when you look at the city of Lawrence and the greater Lawrence area, and you look at the Merrimack Valley and other former industrial hubs like Lynn and other cities across Massachusetts, there's a lot of inequity when comparing the city and the surrounding communities. And so my question is, I guess for the first part, how do you see panel members or researchers, how do you see that contributing to this issue overall? And secondly, do you see opportunity to create equitable exchange and responsible exchange and collaboration and partnership across communities and neighborhoods within cities too? Because especially in Lawrence, there's differences between what part of the city you live in and what neighborhood you're from. Is there an opportunity for partnership that does not remove autonomy from people in a city or a neighborhood and does not take the form of charity, but is actually, a just and ethical relationship that is mutually beneficial?
So I will turn to the panel. I have a few thoughts, but I will turn to the panel first. I know that Senator McGee, you do live in Lynn. I don't know if you want to maybe take a crack at this a bit.
Well, I think that's always the challenge. How do we make sure the resources, particularly in the gateway cities, I think we made great strides, in the last legislative session, or the last 3 or 4 years, focusing on gateway cities, investing in education, but more importantly, giving opportunity for those communities to grow the resources that are going to bring those communities back and make them vibrant. I think we've had some great success in that. So it is really recognizing that in the urban areas there's great potential, but it really needs to be the focus of investment across the board. And so there's opportunity there as we start to focus on that. And there's a Gateway City Caucus. I know Senator L'Italian will be working with us on that. And to all of those issues, starting with education and opportunity, are part of what we see as future growth for our communities.
Yeah, I think there's we can scale great ideas. I think the bigger challenge is scaling great organizations that can sustain that kind of growth. And so I think as we look to that, we got to find great organizations doing great things and make them bigger. I think we have been in conversations with a school in Lowell who wants Playworks coaches. And then it got kind of hung up at the district level. And I do think this work is hard, right? So Boston, some people call us the kind of theme park for national service. There's tons of people, maybe too many partners. Lawrence, everything goes through the superintendent level. So I think your question's a good one. We talk to a lot of school districts who are learning how to engage partners. And I think we take it for granted in this neighborhood that partners are there. I do think there's education on the organization side and the school district side on how to empower partners to come in and be part of that process. And I'm happy to talk more about that offline and our experience in Lawrence and Lowell, as well as Lynn, where we've trained every elementary school.
So I beg to differ on everything goes through the superintendent in Lawrence, really. I think he's allowed a lot of autonomy at the school level to make those decisions of who do you want to partner with, what's an agency that's really going to impact your students and be helpful. So, well, I apologize, I don't really.
You're right, school autonomy, but the process for partners to engage is very different from Boston, where from the partnership point of view, it's just a very different navigation, as how I meant from a partner point of view. And I agree the autonomy has been amazing in Lawrence.
Will address that.
So I do think, just to, no, go ahead. We'll have the Deputy Superintendent Lawrence speak to them. Perhaps maybe the better person to comment right at that moment.
Just to follow up a little bit, I think what you highlight is one of the core tenets with the Lawrence Public Schools was to close the opportunity gap, to make sure that the students in Lawrence have the same opportunities as students in suburbs, whether it's making sure they're exposed to art and music and dance. And so our whole strategy is actually where we're going to push our resources is not actually through central office, but it's actually down to the school level. It's why we cut central office by a third. It's why we continue to limit as much as possible that's not actually in school budgets, because they're the ones who are able to create these great partnerships, as you heard Colleen say. And the nice thing is they're able to work with other schools and other neighborhoods to figure out what are the partnerships that are best meet those students. So what you're highlighting is actually a really core tenet of Lawrence Public Schools and our whole strategy about pushing resources down to the school level.
Go ahead.
Can I then follow up with a geeky research perspective? I'd also say that opportunity obviously is key, and there's plenty of research on disparities with socioeconomic status within different districts, but across the state, those disparities remain basically across the board for, suburbia to urban to rural, which we don't really have. The physical inactivity sort of transcends all, and the disparities we're seeing really are the gender issue and the obesity issue. And there's very little racial ethnic disparity in our state. So this is our state, and this is preliminary data that we hope to publish, but I would say, look, it's across the board. So just because you build a beautiful facility too doesn't mean the kids will engage. So speaking to a Newton or a Concord or a Wellesley, that just because they have it doesn't mean those kids are actually engaging. So it does take champions and us working and great people, and they don't always have to be the wealthiest or brought up at the Ivy League colleges. So I just want to state that it's a problem that goes across the board.
And I do think that to Jen's point, and in answering your question, it is partially why we have focused on schools as a point where, regardless of what the community is, the kids come together, and that those kids who come together in a school often do come from very disparate economic situations, but the school building, the physical activity environment, what a principal like Colleen brings to the school does have an equalizing effect in that it provides all of those students in the school those similar opportunities. So I do think that is partially why we've had that focus. I think we have time for maybe one more question if there's one out there. You seem to be very quick with the draw there, so.
My name is Michelle Robichaud. I'm from Zoo, New England. First, I'd like to say that I have never rowed, but I'm really handy with a canoe. We've been focusing here, I think, very appropriately on schools and the work that you do in schools. But what about non-school organizations? I mean, the zoo has hundreds of thousands of kids who come through its gates every day, and certainly while they're there, they're getting plenty of exercise. But are there other things that other community organizations can do to help with this?
So I think there was a bit of a reference to it earlier. I will turn it back to the panel. I think that, again, one of the great partnerships and the conversations that I've had with New Balance Foundation is that we have, in fact, invested in these community partners to bring physical activity into schools. I think New Balance has actually made a dedicated commitment to investing in out-of-school time programs. So, Megan, I don't know if you want to address that.
Again, and Molly, if you want to join in. But I think New Balance, really, we believe in the community-based organizations. I think that we see all of you touching, again, hundreds of thousands of children each day, and so it's about, how do we message with you? So I think that there are direct service organizations, and I think there are community-based organizations, and how you reach children and how you work with children is different, but it's really about, focusing on what your strength is and what that area is that you're going to kind of impact a child, and then what the funds are or resources are that you need to kind of do that to the best of your ability.
I don't know, Senator, if you have any thought from an after-school time.
I think, the after-school and out-of-school time, and when we've hit our first commission meeting, it's interesting. There's so many different people that do work with young people. We had about 36 different members of the after-school commission in 2007. Many had never been at the same table. And then as we went through it and we did the report, we realized that we didn't really get, there were other people that hadn't been a part of it. So whether it be zoos, libraries, cultural institutions, there's so many different things, different organizations that work with young people. And it is important that we recognize that and work together to build broader relationships as we move forward. And I think the interesting thing was everybody feels like they've got their operation going, and they're working with young people, so they feel like the dollars or the resources aren't going to be available. We need everybody at the table. There are not enough resources to allow all students or all young people to engage in these. So everybody has to understand that coming together, building ways that we know what all the programs are, building partnerships, is how we're going to build a better opportunity for everyone. And so it means all of us talking about it, and I think these forums are really helpful because people that haven't had a chance to talk together are now understanding what else is out there and how do we get more involved to make sure that our opportunity grows it for our group, but also for young people that we're trying to, we're all here together to make young people's lives better. That's the one thing we share.
That's a great plug for the foundation. Thank you, Senator, for the forums. It's part of why we do them. I think to the point that Jen made early in her presentation, it's all of those pieces. It's recess, it's PE, it's before and after school, and it's the other. And all of those pieces have to come together. So I think we have agreement on that. With that, I would like to thank the panel for their terrific participation. And you can feel free to stay there. I'm going to invite our leaders, Paul Grogan, to come back up, say a few closing words before we end.
Well, thank you, Allison. I too want to thank the panel, Dr. Sachek, and all of you for being part of what has been an absolutely fascinating morning. And it seems to be one of these cases where we actually know what to do, but we're not doing nearly enough of it. And that's a problem that should engage many of us in the days ahead. I want to reiterate our gratitude to the Lawrence Public Schools. Seth, thank you for being with us. As you know, just to do a little public lobbying, we would very much like to continue this research project so we can begin to get a longitudinal dimension to it, and look forward to talking with you about that possibility. A couple observations just to close. It came up a number of times that one of the pressures on phys ed and the reasons for its drastic reduction has been the desire to spend more time preparing the students to do better on the standardized tests. In view of this research and related research that we are aware of, that's been apparently a perverse thing to do. And totally counterproductive. I wonder how much better our MCAS scores would be as a state if we had embraced the findings that this research is pointing us to. This has not been a good strategy at all to the extent that it has been done. And in fact, investing in physical activity appears to have a double benefit. Not only are the students more fit, but their learning improves. So it's a powerfully positive strategy to do, apparently, according to this research. One way that all of this intersects very powerfully with another priority of ours in education is what we call structural reform, and it's something that was introduced by the rise of charter schools, but is now spreading in urban districts, this notion of autonomy. Going from a system where virtually all the decisions in traditional urban districts were either came from the central office and from on high, or were dictated by highly detailed and prescriptive teachers' contracts. Junking that and going to a system in which schools are held accountable for results, but in which they enjoy very substantial control over their own budget, their own personnel. They have the freedom to alter the length and structure of the school day, construct summer programs, et cetera. And we now see that not only do we have a terrific charter school movement in eastern Massachusetts, really in the whole state, but that Superintendent Riley has employed this autonomy idea, even though he's a kind of czar himself in terms of the powers he's gotten through receivership, has been able to confer substantial autonomy within that structure. And it's amazing how ingenious and creative people can be when they're responsible. And again, in the old structure, when financial pressures come, decisions would be made on high. Well, we're going to cut phys ed at every school, or we're going to cut arts programs. Whereas if the cuts had to be decided at the school level, they would no doubt be very different. And you see this very clearly in a related realm, which is the whole world of arts, which people have talked about as, again, under tremendous pressure, has been cut or disappeared from a lot of public school budgets. You cannot find, I challenge anyone to do this, you cannot find a charter school in Massachusetts that doesn't have a very, very strong arts program, because they're making the decisions and they're under the same financial pressures as anyone else. But educators, when they are able to make the decisions, find ways to do things that a central office often cannot. So I really believe that the rise of the autonomous school movement, which is now, as I said, spreading into school districts from the charter schools, is a reason for real hope that with that increase in autonomy, more and more educators who are closest to the children every day will figure out how to do that. But the rest of us, of course, have to bring our support, and this is going to be a very important priority for the Boston Foundation going forward, as you heard from Allison Bauer. So once again, we're ending a couple minutes early. Thank you so much for being here, and have a great day.